evening and welcome to Let's Talk About, a multimedia production by Trinity United Church, Legon. This is a show where we critically analyze topical issues of culture and theology. My name is Edinam Ejesika and I'll be your host for today. Everybody freaks out at the mention of the big bad C, even if we don't know exactly what it is. But we all have a fair idea, understanding that cancer is a nasty disease. You may have so many questions to ask today. And so today with me is Dr. Nancy Rose Sasaba, and we are going to have a discussion on cervical cancer. Do tune in. If you have any questions, remember that we are live on YouTube and we are live on Facebook. Welcome, Dr. Saba.
Thank you, Edinam.
Okay, good to have you here today.
Same here, my pleasure.
Okay, good. So today we are going to talk about one of the C's that actually freaks everybody out, cervical cancer. Okay? Anytime anyone hears about cancer, we begin to shake. All we think about is death, and nobody wants cancer anywhere near them. So today, I want you to tell us what cervical cancer is.
Okay, cervical cancer, like most other cancers or all other cancers, occurs when there's an abnormal growth, but this time it occurs in the cervix. That's why we have the name cervical. Okay, so cervix, it occurs in the cervix. And the cervix is what we say the entrance to the womb, simply put. Yeah, so when you have an abnormal growth of cells on the cervix, then you have cervical cancer developing.
Okay, okay. Every woman has the cervix. Would that mean that every woman can get cervical cancer? Or every female person, let me put it that way, can get cervical cancer?
Yeah, I think the answer is in the question, yeah. Once you have a cervix, you are predisposed to getting cervical cancer, yes, because that is where cervical cancer would occur.
Okay.
Yeah.
And is there an age that usually gets affected? A particular age? Or my little daughter at home at 9 years can just get cervical cancer because she has a cervix?
Okay. So for cervical cancer, the causative agent has been found to be a virus. That's the human papilloma virus. So depending on how early in life you get exposed to the virus, it will determine how soon you are likely to develop this cervical cancer. That's if it's not detected early enough. So there's no particular age per se, but it's more of how early you get exposed to the virus.
Okay,
yeah.
So you mentioned something, HPV, and we hear that a lot. Can you elaborate more on that? Okay,
HPV, the full term is human papilloma virus. Okay, so it's a virus that is transmitted mainly through sex. Okay, so it's a sexually transmitted infection, and it has been implicated in the cause of cervical cancer. There are many strains of the HPV virus. Some of them are low risk, what we term low risk, and some are high risk.
Okay.
The high risk ones are the ones that are usually progress to cervical cancer if they are not picked up early. And then the low risk ones, some of them end up causing what we call the warts. So genital warts or anal warts. Yeah.
Okay, okay. Yeah. So you talk about it being picked up early, which means a test.
Yes.
Okay, so at what age do you think I should, as a female, walk into a health facility and ask to do an HPV test? The HPV test and pap smear. Since you've mentioned the pap smear, I think it's the most common one that we know.
Exactly. Okay. So
which comes first?
Well, is there an order per se? Okay, so usually, as I said, from the age of 21 to 29 years, it's recommended that you do a pap smear every 3 years, okay? When you get to the age of 30 to 65 years, it's advised or recommended that you do what we call the co-testing. So you do the HPV test and the pap smear, okay? So if you're able to do the co-testing, that one can take you for about 5 years. You don't need to repeat the test until after 5 years.
Okay.
But doing the pap smear alone is also sufficient, but for that you need to repeat it every 3 years. The HPV test is a test, simply put, that test for the HPV, that's the human papilloma virus, okay? And the pap smear is a test that determines or detects whether there are any abnormal changes in the cervix. Okay, so you can do the pap smear. The results will come out as normal. but it wouldn't tell you whether or not the virus is present. So if you do the HPV test and you do the pap smear and both are negative, then you're sure that there's actually nothing going on there. Yeah.
You should know that many women...
Well, yeah, I think it's basically because most people perceive it to be painful.
Really?
Yeah, most people perceive it to be painful, but it's more of discomfort.
Okay.
But for someone who is not someone who just got sexually active, or maybe someone who just broke her virginity, it might be a bit for some pain. Other than that, for someone who has given birth,
some of the causes,
the HPV, or that's the human papilloma virus, has been identified as the cause of cervical cancer. Apart from that, there are what we call risk factors.
Okay.
There are some things that can increase your likelihood of developing cervical cancer, and one of them is getting sexually active at an early age. Yes. So as I mentioned also, there's no set age, but then the earlier you get exposed to the virus, and that's might determine. Yeah, so getting sexually active at an early age is a risk factor, and also having multiple sexual partners is also a risk factor. And again, it's been found that if your immune system, because of COVID, we've all heard of immune system. Yeah, that's the part of the body that helps to fight diseases.
Okay.
So if your immune system is compromised or weakened, particularly in people who have HIV infection, then you are more susceptible or more likely to develop the cervical cancer from the HPV infection. That's because the HIV infection weakens your immune system, and it's been found that women with HIV infection are at a higher risk of developing cervical cancer. Yeah, and smoking has also been implicated in the development of cervical cancer. And it's also been realized that in the developing countries, as low socioeconomic status is also a risk factor.
Okay.
And in these regions, women are not able to get the regular screening that they may need. So that if there's something going on, they may not pick it up at the early stages. They may only present when the cancer or when the illness has advanced.
Okay.
Yeah.
So what I pick from what you're saying is that, for example, we may have heard a lot being said about pap smear, but this has to do with your ability to pay for it. So in general, would you say that the cost of having a pap smear done in Ghana is high? Is this something that is affordable for everyone at all to be able to do?
Well, affordable is relative. Affordable is relative. So it's done in the government institutions, the family planning centers. So over there, the rates may be a bit more affordable. So affordable depends on your pockets, yes. But then it's been structured in such a way that everyone would be able to access the screening.
Okay, all right. So then we are taking it that it's advisable that as a woman from the age of 21, at least once every 3 years, is that it? Or
Exactly.
we should have a pap smear done?
Exactly.
Okay. What would make me think that I have cervical cancer? What should I observe that would actually make me feel like, hey, I need to run to the hospital, I need to see a doctor? What are the signs?
All right, so some of the symptoms or the signs related to cervical cancer include abnormal vaginal bleeding. Okay, so you may notice that you are now bleeding in between your menses, or for postmenopausal women, you're supposed to have ceased bleeding, but then you realize that you're still bleeding somehow. And then there's also abnormal or offensive vaginal discharge. That's a pointer. Okay, if you also experience lower abdominal pain every now and then, it is also a pointer. Yeah, so these are a few of the symptoms that may draw your mind to the fact that some also may experience pain during sex.
Okay.
Yes, or bleeding after sex.
Okay.
That should also draw your mind to the fact that there could be something going on wrong down there that needs to be checked.
Okay.
Yeah.
So I noticed that most of the things that you mentioned could be something that any lady could actually get and assume it's like just a normal infection. Okay, so at the advanced stage of cervical cancer, what is that symptom that you would just not sit at home? Because when we talk about like vaginal infections that ladies get more often than not, the secretions coming out of the vagina, you may just think it's normal and use whatever medication you use. But at the advanced level of cervical cancer, what should make me run?
Okay, so usually when cancer advances, you begin to experience symptoms like weight loss, fatigue, loss of appetite. Those are a few of them. But I don't think you wait until it gets to that stage, because most of the time when women notice any abnormal vaginal bleeding, they are very quick to report to the hospital. Yeah. So by the time it gets to the stage of weight loss or fatigue or loss of appetite, or low blood levels, by then it means it's really advanced.
Okay.
Yeah.
Is there a cure for cervical cancer?
If it's detected early, it can be treated.
Okay.
Yes.
Okay.
Yeah, if it's detected early.
How is the treatment like? Because we know most of the cancer treatments are painful. What happens with cervical cancer?
Well, cervical cancer treatment depends on the stage at which it's detected. So there are various stages.
Good.
So depending on the stage at which it's detected, there's a treatment that's specified for it. So if it's at a stage that it hasn't spread, it's still localized to the cervix, what can be done for you is either cryotherapy or laser ablation. Those things kind of like take out the cancerous lesions for those that are localized. But if you have higher stages, you may require surgery, you may require radiotherapy, you may require chemotherapy, or a combination. You may require a combination of all these. Yes, and if it's so advanced that not much can be done, then you would need palliative care. That's to manage the symptoms and help you live a bit comfortably. Yeah.
What is the rate of cure?
The rate of cure, it depends, as I said, on the stage at which you present.
Okay.
So if you present in the early stages where it's localized and it hasn't spread, for just like other cancers, once cancer begins to spread, then it becomes a bit more challenging to solve. But it doesn't mean that it cannot be cured, or it cannot be managed. Okay, but then once it begins to spread, then the chances begin to reduce. Once it's localized, you have a higher chance of recovering.
So would you say that here in Ghana, should a woman test and find out that they have cervical cancer, just as breast cancer? I mean, breast cancer is all over the place, and prostate cancer, for example. Do we have enough resources, especially in our government sector, like hospitals, where somebody can easily go in for treatment for cervical cancer? Is it readily available?
Treatment or screening?
Not a screen and treatment. So once you have it.
So once it's detected, yes, you can walk into any government hospital. You will see, you may encounter a medical officer initially. After you are assessed and it's found out that something like this is going on, you'll be referred to see a specialist, that's a gynecologist, and they would manage the case from there on. Yes, so it's being managed here in Ghana.
All right. So I'm just talking about people who probably do not have access to private health insurance or are not able to go to the private health facilities. Are you aware if the treatment for cervical cancer is covered by our national health insurance?
For that, I'm not too sure. I'm not too sure. I can't say. Yes, but you would get some form of treatment. Let me not commit myself. Yes, but I can't say for sure.
Okay. All right. Okay. So we've basically covered most of the parts that has to do with the symptoms and then the causes. I noticed that a lot of emphasis went into the sexual part of it. Okay. So let's assume that we have somebody who is not sexually active. Okay. Maybe they are 21, 23. They are not sexually active. They have never had any sexual encounter. It means that there's a 0 chance of this person getting cervical cancer. Is that it?
Well, since the mode of transmission or the mode of infection is sexual, if you are not sexually active, if you've not had any sexual encounter, then your likelihood is low, 0 to none. So once you've not had that exposure, right? As it stands now, the means of transmission is through sex. That's how the virus is transmitted. So if you don't have sex, your risk is
It's
almost
very
nil. Yeah.
no. Okay.
Yeah.
So back, it's not that I want to emphasize on the sex, but since it's the main thing that causes it,
Right.
we talked about the fact that multiple sexual partners, meaning it's not just about sex, it's about having multiple sexual partners. Is that it? And so would you say that, well, it's wrong. You're either abstaining or you are sticking to one partner. But just for those who are not like us, who want to, who are listening, does the condom reduce the chances of getting cervical cancer?
Yeah, just like other sexually transmitted infections, the condom confers some protection against the transmission or the contraction of the virus. Yeah, so it does. It does confer some protection. Yeah.
Okay. So you mentioned that there were stages, and you talk about early detection. Okay. So take us through. So the first stage, maybe I just saw some blood come in and I went to the hospital. So that's probably an early detection. Okay. At that stage, is it like they'll give me some medication to take in? What happens?
Okay, so the thing about the staging is that the staging is not based on the symptoms. Okay. So for the staging, you actually have to do what we call histopathological diagnosis. Okay. So you take a sample and then it's sent to the lab. Okay. And then they tell you the stage. So you may present with some symptoms, but that is not indicative of the stage of the cancer. Yeah, so that is done specifically by pathological diagnosis. Yeah, so you have the symptom, you present, the doctor attends to you, we do a few investigations, and then from there they will be able to categorize the stage of the illness. Yeah.
Okay. So my question, I'm just trying to rephrase what I said. So assuming this has happened, okay, and they have categorized it as an early stage.
Okay.
Okay. How is treatment like?
Okay, so I think, like I mentioned earlier, for the stages where the illness hasn't yet spread, there are various forms of treatments that can be offered. Okay, so we have what we call cryotherapy, more like freezing the cells to kill the cancer cells. Okay, and then you have what we call laser ablation. And you have what we call electrocautery. All those are means by which the early stages can be dealt with or treated. And then in that case, you can be sure that you are likely to achieve a cure at those stages. But once it gets to a stage, maybe stage 1 upwards, you might need surgery, you might need chemotherapy, radiotherapy. Yes.
Okay. All right. Okay. So assuming a woman for some reason has lost her cervix through an operation, whatever medical condition, that totally eliminates the chances of this person getting cervical cancer because the cervix is gone.
Yes, so if you've had a total hysterectomy, okay, which included the removal of the cervix, once the cervix is not there, your likelihood of, unless there were some remnants that were left behind, maybe, yeah, unless there were some remnants that were left behind, then you might, once the cervical cells are present, you can have the cancer developing, from there.
Okay. Yeah. So one of the risk factors that you mentioned had to do with smoking. Okay. Does the smoking come in because it reduces your immune system, or smoking on its own just makes your body kind of easily picks the cancer?
Okay, so apart from cervical cancer, smoking is also implicated in several other cancers. So it does affect your immune system and your ability to fight illnesses. Yeah.
Okay, all right. So we've talked about the affordability, which you said was relative. We've spoken about the fact that having multiple sexual partners can actually increase your risk of getting cervical cancer. And looking at the current dialysis crisis in Ghana, is there some cause for concern when it comes to treatment of cervical cancer?
Yes, the treatment will actually start, let me say the management will actually start from the screening stage.
Okay.
If people are not able to afford the screening, then you have those who have the infection going on to develop cervical cancer. And as I mentioned, you hear of surgery, chemotherapy, radiotherapy. These are all cost intensive. Yes, they are all cost intensive. And if you don't have the resources or you don't have the financial power, then it might be a challenge.
Okay.
Yeah, managing the illness might be a challenge.
Okay.
Yeah.
Have you heard of situations where people actually come to the hospital and are diagnosed of getting cervical cancer, but do not want to go through the treatment? Has there been any cases like that that you can tell us about?
Well, I may not be able to remember a specific case, but generally, traditionally, people are averse to any form of surgical intervention. So even though they may be going through pain or discomfort, and there's also the fear of surgery. For some people, they believe that once they enter the theater, the operating room, they are not coming back. So they would rather keep what they have and die with it rather than go to theater. Yeah.
Okay. Okay. Are there traditional you already told the question I'm asking.
I can see where your question is going.
Because people want to always have a plan
Well,
B. So if I can't afford
want
surgery, there may probably be some traditional medication that they can take. Is there anything like that?
As far as I'm aware, okay, I haven't heard of any traditional medicine that's able to manage or cure cervical cancer. Yes, so from where I sit, there's nothing like that. But most of the time when people come to the hospital, particularly with the advanced stages of the cancer, and it looks like they are not getting any better, then they may think that getting some traditional treatment or herbal medication might help them get better. But to say that there's traditional treatments for that, I have not heard of it. Yeah.
So if somebody has cervical cancer and it's been confirmed, they must go through the treatment. There's nothing like going to some traditional hospital in the corner there, or going to a prayer camp, for example. And I think these things happen often, and probably due to the economic situation.
Exactly, the economic situation. So for most people, because they can't afford it, okay, some people will try and put up a face like, I don't want your treatment, but maybe because they can't afford it, okay, and in that case, they'll fall on what they feel they can afford, which might be the traditional medicine.
Okay. Yeah. Since we are talking about affordability, do you know of any existing organizations or NGOs that actually people can call on for help? Because I know a lot when it comes to breast cancer. Like, there are so many people who are actually out there advocating and can actually help you with treatment and all that. Do you know any that has to do with cervical cancer?
Cervical cancer, even though it's now picking up, it's not as loud as breast cancer. What we advocate is the screening.
Okay.
So we try and make the screening more public, okay, so that people are more aware of it and they can come in and then get treated. So usually during the month of January, that's when we celebrate Cervical Cancer Awareness Month.
Okay.
So you have some institutions offering subsidized or discounted rates for cervical cancer tests, screening tests, and all that. Yeah, so for that, you can take advantage of that in that area. Yeah.
Okay, all right. So is there vaccination widely available against cervical cancer in Ghana?
Yes.
Is it enough? Because we sometimes hear cases where some vaccines are out of stock, or is this something that is readily available in all our health centers across the country?
So you can visit the family planning units of the government hospitals to find out if they have the vaccines available. You can visit the teaching hospitals, the family planning units, to find out if they have the vaccines are available. There are some private institutions like where I work, the Trust Hospital. We have the vaccines readily available, so you can always come around.
Okay.
Yeah.
Okay.
To
All
be
right.
vaccinated.
Okay. At what age and stage is vaccination advised? Do you get vaccinated before or when you get it?
Okay, so for cervical cancer vaccination, it's been found out that the efficacy is best at a stage before, like it works best before you become sexually active. Okay. So someone who has not had any exposure to sex and gets the vaccination gets a higher level of protection compared to someone who has already been exposed or someone who is sexually active. Yeah, so because of that, it's recommended that vaccination is started from the age of 9 years.
So my daughter can get vaccinated.
Because now you can't really tell. The world is changing.
That's scary.
Yeah. So in order to be sure that you capture them before they get sexually active, they set their age at 9. Yeah, so that both boys and girls, both males and females, is not restricted to one gender.
Okay.
Yeah, so you get the vaccine at that age to confer some protection on you. Right.
Mentioning both boys and girls brings a question to mind. So back to the fact that having several sexual partners is one of the risk factors, okay? So let's assume that a boy or a male who has been vaccinated, I think that would be the HPV, I don't know if there's the vaccine. What is it called?
For HPV.
Good.
Yeah.
So if the guy has it, okay, and is sexually involved with several women, does that reduce the risk for the women?
Okay, so if a male child or a guy has been vaccinated against against cervical cancer or against HPV, yeah, so it's more like it's protecting him from getting the virus,
but not protecting the recipient.
No, protecting him from getting the virus. If he has the virus, he can pass it on.
Oh, that's what I meant.
Yes.
So when he has it, he can pass it on, but the vaccine prevents
him from contracting
from the lady.
Yes.
So then best is everybody
That's
go
why
gets
they capture both girls and boys. Yeah. So that if he doesn't contract it, he's not passing it on.
Okay. Okay. At 9, so would you advise that for the male child also at that 9 year, they also?
Well, it's been pegged at 9 for both boys and girls, so we can't take
so
any
would just
gender out.
hold your daughter and your son and walk to. Wouldn't it look strange to bring to walk into the health facility with these youngsters and say you want to? Wouldn't they look at them in a weird way and say they are in Kolaboni or something like, why are you trying to bring your child at this age?
That's one of the challenges we are facing here in the Western world. It's not an issue, but here that stigmatization may deter people from going for the vaccine or deter parents from sending their children, because it may paint a picture of you being irresponsible. Like, are you giving them a license to? But then let's look at it from this angle. It's better to protect and prevent the contraction. Yeah.
Okay. Are there alternative cures for cervical cancer apart from the going to the hospital and getting vaccinated and going through all that treatment, including surgery?
I think it's similar to the question of the traditional medicine here. So apart from the hospital, I don't know where else.
So you are either going to go through the treatment fully at the hospital, or you try to do everything possible not to contract it.
Yes. Okay. So once you are diagnosed, or it's the cervical cancer is diagnosed, you need to be managed in the hospital.
Okay. Yeah. All right. Okay. So we are going to take a short break. Stay tuned. This is Let's Talk About. You can watch us live on YouTube or Facebook. So see you in a short while.
This is GKV Foods, a community-based zero-waste agro-processing company focused on the coconut value chain. It came about as a result of the health condition of the owner. So I was diagnosed with diabetes, and a friend introduced me to coconut oil as a food supplement to help stabilize my sugars. So after a couple of months taking the oil, I realized that yes, there was a significant change in my sugars, which caused me to look more into the coconut oil as a food supplement. Our product is basically the coconut oil and then coconut powder, coconut shell charcoal. We are looking into other new products, including coconut snacks. Basically, we use the cold press methodology. So at no point do we add heat or any additive for that matter. So it's just pure coconut oil squeezed out of the coconut meat. We currently can do about 25,000 nuts a day. So 30,000 liters of coconut oil in a month.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Hello and welcome to Let's Talk About. Remember, we are still live on Facebook and YouTube. Dr. Saba, we are back. So we have so many questions, and then we'll try and answer them. So the first question says, does one need to prepare in a special way for a cervical screening session?
Okay.
Yeah.
There's no specific preparation, okay, but usually when you're menstruating, it can't be done, okay, because the blood would obscure the area where the sample is being taken, and it might interfere with the results of the test. So when you are menstruating, it can't be done. Or if apart from menstruation, if you're having any if you are bleeding at the time, it can't be done. You have to wait for the bleeding to stop before the test can be done. Yeah.
You know, when you were just talking about the test, the question just came to mind. You know, most ladies also find it a little bit uncomfortable to go for these tests and have men going down there and being the ones to take out is there a way you get to a health facility and opt for a female to do the screening?
So most of these tests are done at the family planning units, okay, and you have female nurses doing the tests, but most gynecologists are males, and they see you when you get pregnant. They see you through the stages of pregnancy. Some even conduct the deliveries.
You see, pregnancy is a different
thing.
When you are pregnant, you know no shame at that particular time.
Yeah, so
but imagine that you are single, not married, in your 25, and it's obviously that it's through your sexual acts
like I said, most of these tests are done at the family planning units, and then you have the nurses doing the pap smear test.
All right. So we have another question.
And there's a female. You can opt for a female doctor to do it for you.
I hope they will not, give you some side eye.
Oh, why would we? That would be unprofessional.
All right. So the next question. We've talked quite a lot about the individual, but this is not something that affects just one person, is it? What is the role of the family, the church, and society at large? How does the church come in? How does the family come in once somebody is diagnosed of getting cervical cancer?
Okay, so the family, the church, the society all have a role to play. So even before the diagnosis, we can start from even before one contracts it, okay? Since this is a Christian program, it says train up a child in the way he should go. And the Bible admonishes us to flee sexual immorality. So abstinence is the best, okay? If you are not married, the best is to abstain, okay? And that's the best preventive method. So that's the role the family can play. The parents can train up children in that way to know that if you are not married, you don't have to get sexually active. So that's one way to prevent someone from contracting the virus and going on to developing the cancer. So in case if someone is diagnosed, the family again has a role to play, because the diagnosis of cancer is huge for most people. Okay. So for some people, just hearing the diagnosis alone is like writing a death sentence for them, even though it's not supposed to be the case. So the support from family plays a huge role, a very huge role. And then support from community also plays a huge role. And then support from church. Support from church can also be likened to support from family at the early stages, teaching children to be sexually abstinent. And financial support from the family, financial support from the church, financial support. This is where we can advocate for support. As at now, most of these advanced stages are not covered by the health insurance, so we can push more advocacy into that, to get support from that end also.
So what would you tell a husband who happens to have the wife being diagnosed that they have cervical cancer? I'm asking this especially because of the whole idea of the sexual contraction. When she gets it, is that something they do with the husband? Does he need to go and get tested for HPV? What happens? Okay,
so for males, when they have the virus, it doesn't really harm them. So they can be carrying the virus around and they may not have any symptoms from it. Except in cases where men who have sex with men, they develop anal cancer from the HPV virus, yes. But for a husband whose wife has been diagnosed, he may not need to undergo any specific investigation or treatment, but he will need a lot of psychological support and financial support, because treatment is not cheap.
It's not cheap.
Yeah.
Okay. So we have a question by Theophilus Nete. If I'm vaccinated as a man from contracting HPV, can I still transmit it to another person? I think.
Okay, so vaccination, simply put, vaccination protects you from feeling the effects of the virus.
Okay.
So the reason we advocate for boys and girls to get vaccinated at an early stage is so that it prevents them from contracting the virus. If they don't contract it, they wouldn't pass it on.
Okay.
Yeah.
Okay. So what? How about education on other cancers together with screening services? I'm not sure if I quite get the
question.
Not too clear. Yeah, I think the person wants to know if the other cancers, like during the campaigns, and I think we do know of breast cancer, we know prostate cancer, we know. So I think the person is trying to know if all these, during the educations related to cancers, all of them are spoken about.
Okay. It's there. For now, it looks like these cancers have been designated specific days.
Okay.
On which awareness is created. Like I mentioned, cervical cancer mostly in January. For breast cancer, it's mostly in the month of October, and for prostate cancer, it's now being advocated. So in the month of November, you have prostate cancer being discussed. So at each and every point, and every cancer has its day it's celebrated. It's just that some of them seem to be more louder than the others.
But why is that so? Why is there so much noise about breast cancer and then
usually
cervical
it's
cancer?
When you look at the statistics, you look at the cancers that are causing more deaths. And those that can be prevented if they are detected early. So that's why it seems like a lot of emphasis is placed on them, because they can be detected early and managed, but they are not being detected, and in the end they are causing a lot of deaths. That's why you seem to be hearing a lot about them. Yeah.
So the next question, it's a general one for you. You are currently a key member of the Trust Hospital's wellness team. Can you describe what wellness entails in women's health?
Okay, wellness is a technical term. Okay. So generally, wellness, you are looking at preventing one from contracting or from falling ill, simply put. Okay, so what are the measures, preventive measures you put in place to prevent one from falling ill? And most of the time we advocate healthy living, and then annual medical checkup, basically, yes, and then education on some of the common illnesses and how to prevent one from contracting them. So wellness is simply making sure or helping individuals live healthy lives, and then to prevent them from contracting preventable illnesses.
So the next question says, has the wellness approach helped to catch cervical or other cancers early?
Yes, so these screening methods or these screening tools actually help to pick up or identify people who may be in the early stages of illnesses. Particularly, if you talk about breast cancer, you have early identification of breast lumps, which, when identified, we are able to manage them to prevent them from progressing to advanced stages. Yes. So yeah, the screening helps in early detection, and then it helps to curb the further progression of the illness. Yeah.
Would you say that I want to assume the limited resources available, especially for the public sectors, in having more campaigns about these cancers could be one of the reasons why we are not able to catch people at the early stages?
Okay, so limited resources may play a role. And then education is also crucial in creating the awareness. So once you make people aware and you make the resources available at an affordable price or free, yes, then they'll be more open to get screened. But if you tell me to get screened and I come and I have to take so much out of my pockets when I haven't even finished feeding my family, then I may be reluctant to come for that. So education and screening, very crucial.
So I'm told next week You'll be partnering with us again, Trinity United Church, for some health screening.
Yeah, so we'll be coming around for the annual breast cancer screening. It's part of the celebration of the Breast Cancer Awareness Month.
Okay.
And it's our contribution, to members of the society to help screen or to pick up, if present, any suspicious symptoms or signs, and then to walk those who are identified with such through the process of treatment. Yeah.
Okay. So I would want you to look in the camera and speak to our audience, inviting them, one, to ensure that in this month they actually go for the breast cancer screening, and also for them to tune in to us next week again, since you'll be partnering with the church, and to also be part of the whole process.
Okay, so hello viewers. We've spoken at length today about cervical cancer, but we'd want to sign off with breast cancer. We're in the month of October, where we create awareness about breast cancer. In this month, you have a lot of screening programs going on, which I would encourage each and everyone to take advantage of, because usually after October, you may not have access to the discounts and then the free screenings that may be available. And getting screened by a health professional once a year is one of the ways in which you can help prevent breast cancer. So please take advantage of it. And we'll see you again next week on Let's Talk About. Thank you.
Thank you, Dr. Saba. So despite being a preventable and curable disease, cervical cancer is responsible for a large burden of suffering in women around the world, especially right here in Ghana. I hope that today's discussion has shed some light on how to spot the early signs of cervical cancer and seek treatment. You've been listening to a discussion on cervical cancer on the show Let's Talk About, which again is a media production from Trinity United Church, Legon. I have been talking to Medical Officer Dr. Nancy Rose Sabah. Thank you so much, and see you again next week when we talk about breast cancer. Have a good evening.